Okay, hello everyone, Dr. Rich Castellano, the Smile Doctor here. We're here today with Carol. Carol, thank you very much for letting us share your video and do some teaching with your lift today. How are you feeling?
Fine.
Carol is a very relaxed patient. She's had some of the relaxing medicine, but she's relaxed already. You're just kind of a relaxed person, and so we're going to be doing a lifting procedure for her. This is not a traditional facelift, all under local anesthesia. You can see from her pictures, she just wanted to tighten up the neck and the jawline. Hello, everyone. Thank you all for watching, and thank you for sharing. So, Carol, can you share with us what inspired you to do a cosmetic treatment?
Well, I didn't like the marionette look. I wanted it pulled up.
Okay, well then you've come to the right place, and you had a chance to, I'm just going to zoom in here. You had a chance to look through our book. Was that helpful?
Yes.
Very good. And so, perfect. All right, and we've done the numbing medicine already. Okay, so it's pretty numb, and now what I'm going to be doing is I'm going to get my gown and sterile gloves on. I just need numbing medicine. And so, thank you all for watching. If make sure you share with your friends. They're going to want to know you're watching live procedure here. And we're also using the laser lipolysis with the lift. Now the laser, what the laser does is it removes some of the fatty tissue and it creates a thermal injury under the skin to help tighten things up. And so if you have questions, you can look us up at imagelift.com, or definitely feel free to watch the procedure. We will be rebroadcasting, so make sure you're following, that you get notifications, because we'll shift gears through the procedure and change the angle, and then that way you can see. And for the physicians and the students that are watching, normally for these types of procedures, we will do Valium, and then the local anesthesia is a tumescent solution. And so we're going to start off with the laser lipolysis, so we're just going to get some of the eye shields here. And before we start with the laser, and so what we do is she's going to grab some of the eye shields for us. That's perfect. So I'm going to set this over here. Great. All right, thank you all for watching. If you're just now joining, I am Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. We're in Tampa, Florida, and in the Villages, Florida. Hello, thank you for watching. So, now that we've done the numbing, the laser lipolysis uses a ND-YAG laser, 1064 and then 1320 wavelength. It's about 20 watts. Thank you very much. Very good. So, when we use the eye shield, so we're just putting the eye shield straight over top. Can you go ahead and turn the laser on for me, please? So, Carol, your job is to keep your eyes closed, number one. Number two, we only activate the laser when it's in a safe place to do so. And number three, you've got the eye shield protectors. You feel a little pressure here? Mm-hmm. You'll feel pressure. If you feel any pinching at all, you let me know. So, now, when we've done the tumescent solution, there's a little bit of epinephrine in the solution, which causes vasoconstriction, which, as you can see, there's really very little bleeding. I do a little cautery. This is bipolar cautery. Yeah, hit that one, and then bring the whole device a little closer to me, please. So you'll need to hit start. Perfect. And then when it says wait until that's done and then ready, that's perfect. So now, when I use the bipolar cautery, hello, Khalil. Thanks for watching. So just a little bit of cautery here. That's fine. That's close enough. Then one more. Perfect. Mm-hmm. Carol, how are you feeling, dear?
Fine.
So for this type of procedure, patient goes home. As soon as we're done, they drive home. We see them the next day. I call later to check in on them. This is not a traditional facelift. There's no general anesthesia, no IV sedation, no surgical staples, and no surgical drains. So now that we've made the incision, and you can see there's really no bleeding to speak of, this is the laser lipolysis on the end of a cannula here, the fiber optic with the helium neon guiding beam, the red. And so once I put the cannula in place, then I depress the foot pedal, and you hear the little popping noises. Now that popping is the laser activating and breaking up the fat cells and creating a thermal injury under the skin. Everything's looking good. Thank you for watching and thank you for sharing. We're on Facebook and on Instagram. We're on ImageLift now on Instagram, and on Facebook we are imagelift.com/Facebook. I'm just going to put a little bit of gauze here, and I'm going to do a tiny bit of cautery. Thank you for watching. Thank you for joining. Perfect. Very good. How are you feeling, Carol?
Fine.
A little pinch there?
No.
Okay. I always like to check in for the physicians and students that are watching. I like to frequently check in with patients and say, how are you feeling? Do you feel a pinch? And they'll tell you if they feel a pinch, you'll see it, and we give them a little bit of the lidocaine. Perfect. Everything's looking good. Hello, Mary. Thanks for joining. So a little bit more of the laser lipolysis here. And I'm right under the skin. So the technique for the laser lipolysis for the physicians and students that are watching, this is subcutaneous, and I'm just very delicately just pushing the cannula through, and I can guide here with my fingertips. You want to be careful because you don't want to create a burn on the skin. You know, years of experience in thousands of cases gives you an idea of how to do it. And I like to go across the jawline, again, for tightening of the skin with the thermal injury underneath, and then removing a little bit of the fatty tissue. I will also be doing a direct liposculpture with my surgical instruments when I'm lifting the skin. Hello, Evelyn. Thank you for watching. Please share, everyone. Let others know that you're watching live surgery, because if you tell your friends that you saw this, they'll be upset that you didn't share with them and let them know. Everything's looking good. We monitor blood pressure, we monitor heart rate, but most importantly, we monitor the patient. Carol, how are you feeling?
Fine.
Perfect. A little more slack here. Do you have your temperature? Hello, Rashid. Thanks for watching. Hope you're doing well. So now I'm guiding with the cannula and also with my fingertips. I can feel where the tip of that cannula is, and it elevates the skin. It also creates a little bit of hemostasis, which is the fancy word us doctors like to use for stopping the bleeding. Hemo meaning blood, stasis meaning to stop. And it does help to lift the skin flap when I'm doing it all the way. You see I'm right out in the preauricular area for the students and physicians that are watching. A lot of doctors will tell me, they're like, how do you do a lift like that under local anesthesia? And really, there's no other way for me to do this. You can numb any area that you desire. Some doctors say, well, if you go too far in the neck, don't you need a general anesthetic for that? I can numb as far as I'd like. I don't like to go too far because patients don't want the extended overdone lift. Carol, how are you feeling, dear?
Just fine.
Very good. If you drift off, we'll wake you up when you're all done. Carol, you came out to our seminar?
Yes.
Was that helpful to come to the seminar?
Yes.
Okay, very good. You had a chance to talk with some of our patients, and it's an honor to work with patients. We are never too old to invest in ourselves. People are living so much longer, living productive and useful lives. Hello, Valerie. Thanks for joining. Everything's looking good. We will be using some of the Occumend patches as well for Carol, the anti-bruise patches. The full disclosure is I do a little bit of consulting work with Occumend Sierra, and we share their treatments in our videos, but patients have been using the Arnica montana for years, but now we have a direct transcutaneous route, and our patients have definitely been getting a good result and have been happy with it helps to speed up the healing, reduce the swelling, and reduce bruising, and that's a big bonus when you can reduce bruising, especially for facelifting or filler patients, especially when it's on the face. Hello, Kelly. Thanks for watching, and thank you all for sharing. Some of you are asking the pricing. If you go to imagelift.com/pricing, you'll see the price there. And if you want to go to one of our events, go to imagelift.com/events. We have one event on Wednesday, I think. But go to imagelift.com/events. We also see, you see the little laser finder there. That's Lainey here, who's got everything set up perfectly for us. Thank you, Lainey. And she is measuring the skin temperature. I like to keep it below 37 degrees because you want to create a thermal injury, but not too much. Just enough, but not too much. So now I'm going back to the preauricular skin flap here. Thank you for watching. Thank you for sharing. Those of you who are just now joining, I am Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon here in Tampa and in the Villages, Florida. How are you feeling, Carol?
On.
Everything's looking good. Perfect. Temperature, please.
34.
Very good. So I measure the energy that we deliver. I feel the heat with my fingertips, and then we also measure with our external temperature monitor. So we use multiple points of reference to get an idea of how we're doing, and we measure heart rate, we measure oxygenation, pulse ox, but most importantly, we monitor the patient. I'm seeing every breath they take. If the patient feels anything, they will wince or move, and I'll see that, and then I'll ask them, and we'll give them a little bit more numbing medicine. Everything's looking good, Carol. So, Carol, do you have any books or movies you're going to get into while you're relaxing at home?
Yeah, I take some things.
What kind of things do you like to watch on tape?
Hallmark.
Okay, there you go. Those are popular movies. And so patients can just relax for a few days afterwards. There's physical versus social downtime. Physically, we get back into our routine, errands, shopping, things around the house within a day or two. Not 100%, but you can get back into your routine. Socially, we pass the grocery store test. 7 to 10 days. You walk into the grocery, nobody really does the double take. Everything's looking good. Thank you for joining. Thank you for watching. Hello, Dawn. Thanks for joining. This is Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. We're here in Tampa and the Villages, Florida. Carol is doing very well. We're doing the laser lipolysis. This is with the Cynosure triplex device. Hello, Christine. Thank you for watching. Temperature, please, Lincoln. Find me the highest. Now we're on YouTube, we're on Facebook, and we're on Instagram. So Instagram is ImageLift now, Facebook is ImageLift, and YouTube is also ImageLift. Thank you. Very good. Make sure you tell your friends, share with your friends what you're watching, because if you tell them you were watching live surgery, they're going to get upset with you by saying, well, why didn't you let me know? And this is a great way to educate patients. A lot of patients are unaware they can do treatments like this. This is why we share, to let people know what their possibilities, what their options are, because most patients don't want a traditional facelift. They don't want general anesthesia, they don't want IV sedation. That's why we're here. We do a lot of facial fillers. There are 3 general areas we address on the face. If we sag, we tighten. If we lose volume, we fill. Sun damage, wrinkles, and sunspots. Carol definitely feels comfortable. How are you feeling, Carol?
Fine.
Okay, good. Sun damage, wrinkles, and sunspots, we can polish and repair the skin. The most impactful thing we do to our face, better than all the other, that's our behavior. Hello, Robin. Thanks for joining. There's nothing that looks as good as Mother Nature's free facelift. When we smile, Carol definitely knows the power of smile. She's a great smiler. And that is always what looks the best. That's our model for what looks good on the face. Now, there are 4 basic principles for plastic surgery, for good plastic surgery. Number 1 is safety. Safety first. Number 2, you must look natural. Number 3, prevent future aging changes. And number 4, let's get as much improvement as possible. We can't make things perfect. We want to make them as good as we can. And we have to keep in mind that we never see ourselves the way that others see us. What temperature, please, Lainey? Sometimes we can be a little hard on ourselves, and the key to keeping that in check is understanding why do we not see ourselves the way that others do. Because when we look at other people, we glance and we're social, right? We're social glancers. But when we look at ourselves in the mirror, we do not glance. we stare and we glare. Here, I'm going to give this to you. Okay, you can change your gloves and turn that off. Okay. So we never look at ourselves the way that others do because we're staring and glaring at ourselves, and we shouldn't be too hard on ourselves. If you stare and glare and look for imperfections to another person, they will say, well, wait a minute, that's too much, please back off. Well, we shouldn't do that to other people, and we shouldn't do that to ourselves. So I'm going to turn your chin all the way up here. That's perfect. All right, thank you for watching. If you're just now joining, I am Dr. Rich Castellano, double board certified facial plastic surgeon. These are the Cons for facelift scissors and the Brown Adsons. Carol, I'm just going to lift your head up here. Is that okay for you like that? And then I use both hands when I operate. I use my left hand here to just elevate the skin. We already have a nice plane where the laser lipolysis has helped us to lift a bit of the skin, and then the Cons facelift scissors will do the rest. As you can see, nice and easy and gentle. It's an advantage for me to be able to use both my hands when I operate. It helps me get a different angle much more easily without shifting my body position. And I like to do a wide undermining here. So everything's looking good. When we give relaxing medicine to our patients, Carol is definitely ready to take a nap, but if I call her name, how are you feeling, Carol?
Fine.
She's responding, so, which is always the norm. We wake patients up when they're done, take them to the restroom if needed, and then walk them to their car. So I switch hands here. Hello, Joanne. Thanks for watching. Everything's looking good. So now I'm able to access the other side. And as you can see, there's really minimal bleeding. We have some of our patients on blood thinners. We can still do treatments for them. And that's because of this technique, because it's not a traditional facelift. It gives us more options. I tell patients if they need to come back another day and do more, it's better than going too far. Not too common that we need to do touch-ups, but if we have to, then we will. Now, if we're doing facial fillers, there are 3 basic decisions that we make with facial fillers. We're not doing facial fillers for Carol today. Can you give me the Ragnall and the Alfred, please? We're not doing facial fillers for Carol today. You see a little bright light here. Perfect. And so I see just a little area to cauterize. And Lainey has everything set up perfectly, makes it very easy. Thank you, Lainey.
Thank you.
And Nina and Ari were here today as well. That also, we have such a great team. I'm so proud of our team. And they take wonderful care of me. They take amazing care of our patients. Very good. Thank you for watching. Thank you for sharing. Perfect. Switch, please, so I can observe over here. Thank you. So switch hands. Very good. If you're watching, make sure you are subscribing, because when we rebroadcast, you'll want to see what we're doing. We will be changing the video during the procedure. So minimal bleeding. Relax. Very good. For those of you asking about the pricing, you can go to imagelift.com/pricing. You can also go to imagelift.com/events and see where our next upcoming events are. Okay, switch for me, please. Perfect. So we have our little light, and that'll cause, you see a little bright area. I'm just elevating through here. Everything's looking good. Thank you for watching. Thank you for sharing. Perfect. So now what I'm going to do is I'm taking the Cons facelift scissors as I have elevated the skin and just trim a little bit of the fatty tissue. For the physicians and students that are watching, I go down to the level of the platysma muscle. So you see a little vessel there, so I just cauterize that as we go. You feel a little pinch there? Carol, do you feel any pinching there, dear? Okay.
No.
I like to check and see. So a little bit of the fatty tissue, and we take care of that as we go. Perfect. Everything's looking good. Carol's definitely feeling comfortable. How are you feeling, Carol?
Oh, well, the snore was there.
Okay, all right. Well, as long as you feel relaxed, you know, I feel pretty relaxed too. But I'm not going to take a nap. We've got work to do. And Carol, everything is looking really, really good. You're going to love it. Perfect. Very good. Very good. So now that I'm removing a little bit of the fatty tissue, then I just cauterize some of the blood vessels. Perfect. You feel any pinching there?
No.
Very good. All right, thank you for watching. For those of you who are just now joining, I am Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon here in Tampa and in the Villages, Florida. Hello, Dr. Lamb. Thanks for watching. Good to see you. We will be at the ASAPS meeting in New Orleans this month. So please come say hello if you're at the meeting. Perfect. Okay. So I use the gauze and it clears the field. There's tiny little blood vessel there. We just cauterize. Perfect. And then I look on the other side as well. Exposure over on the other side, please, right here. Hello, thank you for watching. Thank you for sharing. Remember, we're on Instagram at ImageLiftNow, and we're on Facebook at facebook.com/ImageLift. We're also on YouTube. We'll be at the Aesthetic Show in July. We were just at the COSM meeting in Austin. Perfect. So now I'm just elevating right on the inferior border of the mandible. I'm going to adjust your head just a little bit here. Carol, how are you feeling, dear?
Fine.
Very good. So I'm just elevating the skin over here because we want to tighten the area where people talk about their jowl. That's an area where people want their best, some of their best improvement. So that's where we're focusing. And Lainey's doing a great job exposing for me. I use the Alfrecht retractor for the students and physicians that are watching. And then a Ragnell. I like to use the Ragnell and not the Sang because the fewer sharps on the field, the better. Safety for patient, safety for team and staff. So the entire procedure is designed and planned with safety in mind. Hello, Rick. Thanks for watching. Okay, so now exposing the middle, and I'm going to do a little bit of suturing. We call it the corset platysmoplasty. Perfect. So all this fatty tissue, we'll get rid of this here. And then I like to use a 2-0 Merceline or Ethibond suture. And you can see here that we're pulling the edges of the platysma muscle together. Very good. Please keep your retractor in that at all times. Yeah, keep your retractor in at all times. That's perfect. Okay, now I do like to do a running suture for the platysmoplasty. Thank you for watching. Thank you for sharing. If you're just joining, we are on Instagram, Facebook, and YouTube. So let your friends know whichever their favorite way to watch is. We are there. Carol, how are you feeling, dear? You doing okay, Carol? There you go. She's just drifting a little. I'm going to adjust her head a little bit there. There we go. Carol, how are you feeling, dear? You feeling all right? Okay, good. I'm going to trim a little bit of the fatty tissue here. And just before, you know, Carol's a very relaxed person, so when we gave her the relaxing medicine, I asked her, I said, do you feel the relaxing medicine? She says, I don't feel it that much, but you definitely feel comfortable. We will make sure you feel comfortable. That if you're not comfortable, I'm not comfortable. And some patients talk the whole way through the procedure, and some, they don't remember any of it. Everything's looking good. Perfect. So you'll feel it a little bit tighter here, Carol, under the neck. We are in Tampa and in the Villages, Florida. It's an honor to work with our patients. That's the best part of what we do, is the people we get to work with. And it is never too late in our lives to invest in ourselves. Perfect. Very good. Carol, you're going to feel it get a little tight under your neck here, okay? You'll feel some of that tightness, and that tightness does soften up. Thank you for joining. Thank you for watching. Perfect. Very good. So I always like to tell the patient what we're doing. That way they get an idea and they feel comfortable about things. It's for the physicians and students that are watching. It's very, obviously it's reassuring to the patient. If you don't tell them, they'll wonder. They'll say, is everything going okay? So I like to tell them it's going well. Things are looking good. You're going to love your result. Keeps them in the loop. You feel a little pinch there? Carol, do you feel a little pinch there, or not really?
No,
Okay.
just a tug.
Just the tugging. Okay, normal to feel the tugging. So I'm going to, so together I can't see as much, and then here I can. Not in the corner. Here. Perfect. Very good. Thank you for watching. Hello, Sunny. All right. And I'm just going to do a little bit of gauze for visualization. We get some serous fluid, a little serosanguinous fluid, and then get rid of that. But as you can see, there's really minimal bleeding, even for our patients who are on blood thinners. They can do this type of procedure, and I tell patients to stay on their blood thinners. Hello, thank you for watching. If you're just now joining, I am Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. We're here in the Villages, Florida, and in Tampa, Florida. And our motto is look good, feel good, do good. Just gonna adjust your head just a little bit there. That's perfect. How are you feeling, Carol?
Fine.
Now, and then you'll hear the numbness in your lips, Carol. That's from me. That's the numbing medicine that we did. Your lips will feel goofy, and you'll talk a little goofy because it's like being at the dentist office with that numbing medicine. So that does go away about an hour after we're done. And I tell patients that it's a good idea to check every 2 to 3 hours to see if they need a pain pill after. Usually the numbing medicine wears off about an hour afterwards, but that way you stay ahead. You don't want to sleep for 6 or 8 hours in a row afterwards. Hello, Dee Dee. Thanks for watching. Thank you all for sharing. Because if you sleep for a long time afterwards, then you can get behind. Everything's looking good. I'm just going to move your head a little bit here, Carol. Is that okay for you there?
Fine.
Okay, very good. Thank you, Carol, for being such a great patient. Everything's looking good. And I really do feel like I'm retired. You know, I get to, please put the retractor in at all times, yeah. I get to do the things that I love to do and spend time with people I love to. And we got an amazing team and the best patients. We have a lot of fun. And over here, can you expose for me, please? Hello, Denise, with the... Yep. Thank you for joining. Perfect. Very good. Perfect. And when you're observing, you know, I can even see the little blood vessel, and if I cauterize it, if it doesn't cauterize the way I want to, I'll put a little stitch to just get the right, as we call, hemostasis. Perfect. Thank you for watching. Thank you for sharing. Make sure you let your friends know you're watching, because they're going to get upset if you tell them you were watching live surgery and then you didn't share it with them. And I'm just going to do a little bit more contouring through here. Just a little bit. Just enough, but not too much. That's the artistry of what we do. We like to fuss about the details. Now, release for me, please. And then, now what a big improvement, by the way, from where we started, but we're not done yet because we're going to be tightening from the sides. So it's definitely going to look natural, and Carol will see a big improvement. I'm going to adjust your head a little here. Is that okay for you like that, Carol?
Fine.
Okay, very good. Perfect. So you can already see the profile of her neck is a significant improvement there. And so what I'm going to do now, let me just expose over on this side. Can you put the Alfrecht on this side? And the Ragnall, thank you. And chin up, that's great. So up, there we go. Perfect. So I use the gauze for visualization, and any little bit of blood we can move away. Hello, Janet. Thanks for watching. Everything's looking good. And sometimes I'll see a little blood vessel that's on the surface of the skin. So you just follow gravity as to where the little vessel may be. And it's a bright light, which affects the white balance on your part, but it helps me to see a little bit better. So I'll do some parts with the light and some without, just to make sure we can see what we need to. Very good. We are in Tampa and the Villages, Florida, for the students and physicians that are watching. This is all under local anesthesia. Perfect. And make sure you stay right where you are. That's perfect. Very good. We will be rebroadcasting, so make sure you are following. I'm going to lift, so there you go, just like that. And then I'm going to adjust the light just a little bit right there. Perfect. The gauze allows visualization. And if there's a little blood vessel, you just blot away any bleeding you see, and that allows you to identify where the blood vessel is. Hello, Jerry. Thanks for watching. Thank you all for sharing. Perfect. Okay. So I like to be fastidious and detail-oriented about the hemostasis here. That's my prerogative. Sometimes some doctors will say, well, put a little pressure and you can leave it be. And that certainly is fine to do hemostasis, but I like to control as many of the blood vessels as I find and then move on from there. Many ways to do the artistry of what we do. Perfect. Very good. Thank you for watching. Thank you for sharing. Perfect. Okay, hold that position right there because I'm just going to trim a little bit of the fatty tissue. Okay, so now what we're going to do is start lifting here. Stay right where you are. And I am going to tuck a tiny bit of gauze there, and I'm going to dissect to that area where I can see from over here. Perfect. And the flexibility of the skin and tissues allows you to get great visualization. Okay, let that part go. Okay, I'm going to turn your head this way now, Carol, nice and easy. Does that feel okay for you like that?
Mm-hmm.
Okay, very good. So now what I'm going to do, and just got a little bit of gauze, I'm going to do lifting of the skin, fine tooth, and 15, please.
Mm-hmm.
Everything's looking good. If you're just now joining, this is Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. So this is our 15, which allows us to make the skin incision. Can I have lots of gauze over here, please?
Oh, yes.
Everything's looking good. You'll feel some pressure here. If you feel any pinching, you let us know. I'm just going to adjust your head a little bit. Is that okay for you there, Carol? Mm-hmm. Everything's looking good. You're going to love it. Okay. And of course, we do recommend that patients have a driver. Obviously, with the relaxing medicine, it's like you had a few cocktails, so you don't want to drive after that. And you do need a driver. We see people the next day, 1 day, and 1 week afterwards. I'm just going to adjust your head just a little bit there. Is that okay for you there, Carol? You doing okay?
Mm-hmm.
Okay, great. And then this goes to the postauricular incision. Can you raise the ear for me, please? Mm-hmm. Thank you for watching. Thank you for sharing. So now, for the students and physicians that are watching, notice I grabbed the skin. That's the traction, and counter traction is actually with the tip of my 15 blade, and Laney's also providing some counter traction. So the combination of the 3 points, Laney, my forceps, and the 15, it opens up the plane, the tissue plane. So that is the dissection and traction of the tip of the 15 blade. You feel a little pinch there? Carol, you feel a little bit of a pinch there or not really?
No.
Okay. Everything's looking good. Perfect. Okay, very good. Thank you. Perfect. All right. So I'm elevating the skin here. Carol, I'm going to turn your head a little bit this way. Is that good for you there? I like to adjust the patient just so that they get I want another. Can you get one for me? Thank you. So we will be rebroadcasting later. Make sure you are sharing. And when when you have good exposure of the head, and then just a little bit more right there. Is that Carol, is that okay for you, dear? Is that position good for you?
Fine.
Okay. And I always tell the patient too, I want you to take a big deep breath for me, in and out. Can you take a big deep breath, Carol, in and out? There you go. Big deep breath. It's just good to remind them, and that way, gets the lungs filled up with air. Big deep breath, in and out. Perfect. Very good. Now, I'm going to put a little bit of gauze right there. Perfect.
See this hand?
Release, please. Very good. I want one of the other types, please. Not one of.
It's perfect.
There's more. We have 6. Thanks. Very good. Okay, so we will be rebroadcasting soon. Make sure you are watching or you're subscribing. More videos will be coming soon. Appreciate you all being a part of our videos. I am Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. Gauze, please. Perfect. A little bit of bipolar. Very good. And so even though I've only lifted a portion of the skin flap, what I like to do is just cauterize the vessels that are there. Ear forward for me, please, Lainey.
Mm-hmm.
Hello, Tara. Thank you for watching. Hope you are well. Very good. So in the crease of the ear, you'll see a little bit of blood vessels and also right by the lobule. So we cauterize those. Hello, Deborah. Thanks for watching. Everything's looking good. Carol is doing super well. And thank you to my team for doing a great job. Ari, Charlene, Lainey, and Nina, setting everything up perfectly with our patients. Carol, how are you feeling, dear? You doing okay, Carol?
Mm-hmm.
Okay, good. I like to frequently...
But the thing's open.
You feel a pinch back there?
No,
No,
my
they're just...
eye.
We're done with the eye shields, so we'll remove those. Does that feel better?
Yeah.
Yeah, so we don't need the eye shields anymore. Everything's looking good. Thank you for watching. Thank you for sharing. Release, please. Cons and browns, please. Mm-hmm. Perfect. So, lifting the skin here, we've already done the laser lipolysis and the tumescent solution. Everything's looking good. So just elevating the tissues, removing the fibrous adhesions between the skin and the underlying SMAS layer. The SMAS stands for subcutaneous musculoaponeurotic system. Everything's looking good. Perfect. So now, once I've elevated some of those pockets, then I just see there's little thin, we create little tunnels, and then you connect the tunnels. That's the surgery speak for lifting up the skin flap. And then I will do some hemostasis once the skin flap is raised in its entirety. Thank you for watching. Thank you for sharing. Hello, Sheldon. All right. So we are doing a facelift under local anesthesia. Patients come in, they don't want a traditional facelift. So this is what we offer them. Everything's looking good. Perfect. There we go. Very good. Okay, Ragnell and Alfred, please. So now that we have these areas, you feel a little bit of a pinch there?
Mm-hmm.
How about now? Do you feel any pinching at all? Carol, do you feel any pinching now or not really?
Mm-hmm.
Okay, very good. Exposure, please.
Mm-hmm.
Okay. So, elevate. And you want to hold, there you go, like a pencil, there you go. Perfect, so you can lift, thank you. So now that we have exposure here, then I'm gonna remove our little gauze that was there. And I'm gonna shine a light. And I'm gonna do some hemostasis from this side as well with my bipolar cautery. Thank you all for watching. Thank you for sharing. Right through here. Great. Perfect. And even though there's not really much bleeding to speak of, there's some, and I like to cauterize all the little veins. Carol feels comfortable, and when we adjust her or just call her name. Carol, you feeling okay, dear? Oh, okay, very good. She's obviously responds to us. Perfect. Now, once I do some of the tightening, it will also give me some additional exposure, but for now, I'm just surveilling the area, and you can see there's very little bleeding to speak of. Now, if patients are not comfortable, then I'm not comfortable. But no matter how relaxed a patient is, I'm just going to adjust your head there. We always can talk to them and get their attention. Carol, how are you feeling, dear? You feel that? Okay. You're feeling pretty relaxed. Oh, you're going to sleep and rest. Okay. You take a nap, and then we'll wake you up when you're all done. Very good. Behind the ear for me, please.
Mm-hmm.
Always maintain exposure. Thank you. Yeah, that's perfect. Forceps light grip. Yep. Right here on the side. Relax. There you go. And behind the ear. Perfect. Perfect. Release for me, please. Release the ear. Keep your retractor, and then retractors both, please. So now what I'm going to do is I'm going to do the 2-0 Merceline, and I'm going to have you lift up. Or Ethibond, and I'm grabbing the SMAS layer here. Great. Very good. So I like to do a couple of passes through the smash, and then we bring it all together in this one stitch. And then as I cinch the stitch down, do a double knot, surgeon's knot here, needle driver. Thank you for watching. Thank you for sharing. If you're just now joining, you want to expose with your ragnell. We flash the suture off. So one click right in the middle. Yep. Just one click. Yep. Okay. And that holds the tension of the knot down. Okay. Off, please. Very good. Keep the exposure, please. And suture scissors on the knot. So when they're deep like this, I like to cut on the knot so that way there's not extra suture that can resurface later. Hello, Steve. Good to see you. Hope you're well. Thanks for watching. Exposure over here. So now I'm grabbing more of the smash layer here. Perfect. Very good. Thank you for watching. Thank you for sharing. We will be behind the ear. We will be rebroadcasting behind the ear. So make sure you're following on Facebook, facebook.com/ImageLift, or Instagram, ImageLift Now on Insta. Very good. Perfect. Carol, how are you feeling, dear?
Fun.
Everything's going well. That numbness, which makes the lips sound a little goofy, will go away about an hour after we're done. Now that I've done the Merceline, the Ethibond, I like to use the 2O Vicryl. Exposure, please, in the front for the preauricular smash plication. Yep, both instruments like pencil. Everything's looking good. You doing okay, Carol? You feel a little pressure there. Do you feel a pinch? There you go. Exposure, please. Yep. And then needle driver. Sorry, needle driver. So then you'll need to extend this over here so you can expose. Perfect. So we monitor blood pressure, we monitor oxygen, we monitor pulse ox, but most importantly, we monitor the patient. The patient's feeling comfortable, breathing easily, good saturations, good heart rate, good blood pressure. We're okay. Take this, please, and curved mayos. Very good. So now I'm just undermining a little bit here. Perfect. Hello, Helen. Thanks for joining. Everything's looking good. So now you see all that extra skin that's redraped here, and I see a little bit of tethering of the skin. Carol, I'm going to move your head a little bit that way. Is that okay for you like that?
Fun.
Okay, good. Perfect. So you see how it redrapes and all the extra skin? So we're going to trim that extra skin. Very good. You take just enough, but not too much. So we take the extra skin. You can see here. Perfect. I'm going to turn your head just a little bit. There we go. And then I measure to the tip of the earlobe, or the lobule as we call it. For the skin flap, we're recreating the preauricular. Skin where the lobule sits. Ear forward for me, please, like that. And I'm going to trim a little bit of this right in through here. Perfect. Release for me, please. So I like to measure, and that's good exposure there. Perfect. Okay. Ragnell and Alfred, please. Oh, I was just telling them that we're going to be doing a little bit of bipolar cautery here now. And so everything's looking good. How are you feeling, Carol?
Well, New York can't hear too good.
Yeah, you won't hear so good in this side just because of the... You won't hear so good on this side because of the swelling. That is normal and it will go away. Perfect. So... Very good. Thank you for watching. We will be sharing other videos, so make sure you are following. Perfect. Everything is looking good. So now we are under the angle of the mandible, and I'm just cauterizing little blood vessels we see here. Perfect. Thank you for watching. Thank you for sharing. Okay. And I can even pass the gauze from under through here, and then I'm just gonna, there we go, through under the chin, and that allows me to check and see. Minimal bleeding. We expect a little bit. But if it's more than what we feel comfortable with, then we just need to do some additional cautery. Very good. We will be rebroadcasting in a little bit here, so make sure that you are following. And just to be, because I like to be picky, I'm going to put a little stitch here. Perfect. Okay. Right in this area. I've done some cautery there, but I just want to make triple sure that that area, that little vein there has adequate closure. Perfect. Here with my finger and just bring that together. Perfect. Everything's looking good. Hello, Michael. Thanks for watching. Good to see you. Hope to see you out at some of the meetings soon. Perfect. So now that I've placed that little stitch, I'm checking the, can you hit the button for me, please? Go ahead. cute? Perfect. Yeah, it looks really nice. And then I'm going to check one more time because I just love to check a lot. Adjust that, please, with your hand. And then also, and then we want to restart on this one. If you just tap the middle of the second one, yeah. And then swipe it up. Yep. Swipe it from the bottom. There you go. Hit save over there. Yep. Good, and then hit share. And then top camera. Nina's our AV person right now. And then hit live on the bottom. And hit it again. Thank you.
You're welcome.
Very good. Yeah, thanks for zooming in.
You're welcome.
For those of you who are just now joining, I am Dr. Rich Castellano, double board certified facial, plastic, and reconstructive surgeon. We're doing an image lift procedure for Carol here today. Behind the ears for me, please. Everything's looking great. Lainey and Nina have everything set up perfectly for me. Makes it very easy. Now, I like to check one more time. Let me turn your head. Carol, I'm going to turn your head all the way to the middle. Release and exposure right in here, please. And so I just want to check one more time while we're here. Good, that's perfect. So we'll have the extra trays tonight?
Yes.
Okay, thanks. I'm going to turn your head just a little bit this way. There we go. Okay. She feels a little bit of a pinch, so I'm going to do some numbing medicine in that area. We have the wrap. So a little bit of numbing. Feel a little pinch there? Not really. A little bit here and there is okay. Are you feeling comfortable, Carol?
I'm fine.
Okay. Very good. If you are attending the ASAPS meeting in New Orleans and you want a profit lift, we're teaching doctors how to improve their practices. Make sure you register for our practice profitability session. Okay. Perfect. Just going to cauterize a little bit right here. Release for me, please. And exposure right into here. Exposure. Holding. Yeah, there you go. Good. So one more time, I just want to test these areas. Perfect. Everything's looking good. Behind the ear for me, please. Okay, 2O Vicryl, please, which is loaded. So now I'm putting some of the deep sutures, fine tooth. So this is the 2O Vicryl. And this approximates the wound edges. The number one thing that causes the least amount of scarring in a plastic surgery procedure is getting the wound edges as close together as possible. Everything's looking good. Thank you for watching. Thank you for sharing. Okay, so this is the just superior to the tragus. We do a little suspension stitch here. Tragus is the piece of little flesh and skin that sits right in front of the ear canal. It's after the Latin word root goat, like a little billy goat's chin. And we recreate that portion of the ear so that it's looks very natural, doesn't look like there's been a facelift that's happened. Everything's looking good. Cut, please. Perfect. So then post-auricular. Behind the ear, please, expose. Perfect. Good. Cut, please. Everything's looking good, Carol. How are you feeling? You'll be done before you know it. Release, please. Tenotomies, please. Actually, just the 5-0 chromic is fine. So now you see how nicely everything comes together. We're going to do the last little stitch. Hello, Rachel. Thank you for tuning in. Everything's looking good. We monitor heart rate, we monitor blood pressure, we monitor pulse ox, but most importantly, we monitor Carol. Carol's looking good and feeling good. Now, Carol, I'm going to adjust your head a little bit there. Carol, is that okay for you there?
Whatever.
Okay, you're cool. Whatever's good for you is good for me.
Vice versa.
Say that again.
Or vice versa.
Or vice versa. There we go. Okay.
Most right.
All right, we're going to switch sides here in just a little bit. So make sure you are following. Oh, thank you, Rachel. You're so kind. Appreciate your kind words. Everything's going very well. We're honored to take care of Carol. She has many active and useful years ahead. You can see her neck and jawline look pretty amazing. So you ready to grab the suture fast? Yep. There you go. Thank you. Perfect. And if you hold the suture, you want to hold it back so that it doesn't get in the way of the ongoing suture placement. Very good. I've definitely thrown over 1 million stitches in my life, putting all the facelifts together. Hello, Jeff. Thanks for watching. Thank you for tuning in. Please do share. If you tell your friends you were watching live surgery and you didn't share, they're going to be upset with you. Some of you are asking about pricing, you can go to imagelift.com/pricing and learn more about the cost. If you want to attend our event, we have a great event coming up on Wednesday. Go to imagelift.com/events. Everything's looking good. That's how Carol found out about us. She came to one of our seminars. Perfect. This is a 5-0 chromic. It dissolves on its own for the physicians and students that are watching. And sometimes you'll take the stitches up, but usually they'll just fall away on their own. I tell patients moist wounds heal the best. We will put a wrap over top. We're also going to use some of the bruise patches with the Arnica Montana, the Ocumend. Very good. So we recreate the area where the lobule comes through. So here I'm providing traction with my hand on the ear, holding that back. So now I'm going to ask Lainey to pull the ear back. And we're going to stitch this area closed. Thank you all for watching. We're in Tampa and in the Villages, Florida. So this is not a traditional facelift. There's no surgical drains, no surgical staples, no cut across the top of the head, no IV sedation, no general anesthesia. Very good. Perfect. Perfect. Okay. Hello, Shannon. Thanks for watching. Cut, please. I'll hold the ear forward. I'm just going to put a tiny little stitch across through here. Perfect. Everything's looking good. Okay. And just tie this little area off. Perfect. Tail, please. Okay, so we will be rebroadcasting. Thank you all for watching. More videos coming soon. And you see her jawline here and how nice that looks. Hello, Tim. And just for perspective, you can see here that as sharp as her jawline is, this is where we started. So now, Let me zoom out just a little bit here. So there you can see her jawline there. So thank you very much to Carol for allowing us to share her procedure. What a nice improvement in her jawline. We'll do the stitching for her jaw after this. So more videos coming soon.